Hi, this is Hospice Joe, where my goal is to help anyone and everyone with any symptom management in the last 6 months of life. So today our symptom is constipation. I would say the definition of constipation is a common gastrointestinal condition characterized by infrequent or incomplete bowel movements, meaning not pooping. So the signs and symptoms of this are very easy. Hard, dry, tiny turds, pushing hard during bowel movements, tummy pain, feeling full, bloated. And the number one cause for this is opioids. Opioids are, like the big guy morphine and his little friends, hydromorphone, oxycodone, fentanyl, even tramadol can be constipating. Lack of movement. A lot of our patients, they don't move very well, or they're actually bedridden, which if you're not moving, that stool's not moving either, causing AKA constipation. Dehydration. A lot of our patients have difficulty swallowing and they get dehydrated. They can't keep the fluids, which fluids give the poop some moisture where it's not hard and firm and having difficulty moving. Also, bowel obstructions can happen from disease process, tumors, things like that. What do we do if we are constipated? Well, the number one thing that you need to do if you're on opioids is get a bowel protocol. And a lot of the bowel protocol are things like laxatives, stool softeners, suppositories, Fleet's enemas, those kinds of things. As a hospice nurse, I try to give my patients a regime immediately. And I like Senna S. Senna S is a laxative with a stool softener as well. You can take 1 to 4 of those twice a day. I like to have that on board because if I need to give, if they're pooping good, I might start with 1 a day. If they're having a little issues, maybe I'll do 1 twice a day and then increase it as needed. It seems to work very well. We also can encourage fluids. Whether it be water, juice, anything like that, or something that comes down into liquid form like popsicle, soup, jello, that kind of thing. Support positioning. Have you ever pooped in bed? I haven't. So if the patient can't walk to the bathroom, sit on the toilet, or get on the bedside commode where they have that gravity to pull that poop down, then you need to put the bed about a 90-degree up. So then that will bring the poop down as well. And that's only if they can sit up and they're supported, but it does help. When to call the hospice team? Anytime that the patient is really having difficulty with abdominal pain or they haven't had a bowel movement in 3 days. We might need to do a digital rectal exam to see if there's stool in that vault. And sometimes some severe things can happen if you get too constipated, which could be hemorrhoids, really bad abdominal pain, fecal impaction, where we might have to go in and manually disimpact a patient if they have that stool there and just don't have the oomph to get it out of there. Then sometimes we got to get it out of there. It's just something that we got to do sometimes. It definitely alleviates a lot of that pain and misery along with constipation. So you also can get a rectal prolapse or a bowel rupture, which is really scary. And that's why it's important to get control of the constipation immediately. So the golden nugget of the day is drink, move, take your bowel protocol if you're on opioids, and take a regular time of day to poop. Sit up and try to poop, poop, poop. May God bless your days and may your poop be soft. Please like and subscribe for more symptom management with our hospice patients. Thanks. Have a good night.